Okay, thank you very much, and I'd like to thank APNA for this opportunity. I'd like to thank Lynn Walker from AMLA for funding this evaluation. I'd like to thank Stuart Constable for your inspiration and passion as his colleague in this piece of work. Also Danielle Duller, I'd like to thank her because this piece of work can't be done without the help. Also my team, Louise Fraser, Louise Greenstone and Dominic. I'm a health services researcher, policy analyst, evaluator. We're part of the Australian Health Workforce Institute, and our real mandate is really building the evidence base. My whole focus is, as an evaluator, trying to support the system, support new workforce models of care. Primary care nursing leadership, is that new? Well, maybe yes, maybe no, but that's what we're trying to build some evidence on. So I'll spend the next 15 minutes, maybe a little bit shorter, talking about what makes the AMLA nursing initiatives work. It's preliminary insights because this work is in progress right now. Okay, I'll be focusing on 2 initiatives, the 12 demonstration projects. That I have to thank Jo Millard if she's in the room. Jo's key to this. The 12 Medicare Locals are involved in these demonstration projects, and also the AMLA Nursing Leadership in Action workshops. I have to thank all the nurses that have participated. We've had well over 300 in those, I think it's 9 workshops now, and Thursday was the last one. 7 of those state-based workshops across the country. Really thank you to all those nurses. As you can see, they are about building leadership capability within primary healthcare nursing. We are the evaluators for these 2 initiatives, and our evaluation is really to identify that. What works for whom in what circumstances? And paramount to this is, how can we build the capability of the Medicare Locals to further not just support nursing leadership, but sustain that? Our evaluation frame is really a formative evaluation, given that it's appropriate for this level. And it's a realist approach. And as you can see at the bottom, evaluation capacity building. Anybody that knows me, that's where I go on about all the time. It's actually trying to instill some thinking. You all can be evaluators as part of this. And so really this segues nicely after Meredith's talk. Not just about researchers, but be evaluators using systematic reflection. Today, I won't be talking about the overall AMLA initiatives, but what I want to do is reflect back to you some of your voices, what you've said to us, your needs, your wants, your actions, your experiences, and that's what I want to give back to you. I will be focusing predominantly on the Leadership in Action workshops. We've done surveys, pre and post surveys. Again, Danielle, thank you for all of that. And we've started off some interviews with all the participants. Okay, initially, some of the challenges. There's always challenges, there's always enablers. So we've asked, what are some challenges and enablers? Nurses becoming leaders. I won't go through all of these, because as you can see, there's quite a number of them. But when I look at this list, and then, again, we're still doing this work, some of these should be very familiar. Time, finance, value, recognition, self-confidence, team dynamics, gender, age inequality. Some of the constant challenges that have been with us for years. Some of these enablers, working in teams, peer support, education training, resources, challenging stereotypes. There are a number of enablers and barriers. Sometimes I just like to think that these as they're the context, they're the experiences that you work within. But they're clear, whether we're talking about nurses in leading in professional sense or in a clinical, these are relevant. We've also asked, not just about what do you need, but we've asked 3 particular levels. What do you need? What do you need at the individual level? What do you need at the organisational level and at the systems level? And again, at the individual level, you've clearly said to us over and over again, it's about skills in leadership, technical, governance skills, social communication skills, but also knowledge. Knowledge is power. Knowledge is key to what we need, clinical knowledge, but also those opportunities for education, clinical supervision, networking, peer mentoring, etc. At the organisational level, very much that list on the right-hand side to you is about the culture. It's having a supportive employees and employees, input in the decision-making, professional development opportunities, funding, time off. At the systems level, what we start to see is a whole range of, again, supports, whether it be around governance, roles, money, education. I think, again, we need to be thinking about this systematically. That's why we're trying to ask, let's break it down. Let's not just ask, what do you need? Because I think there are different organisations that can support in each of these. And again, I must say, many of these, the evidence does already exist. We're not the first people to be looking at this area, but we need to build on this evidence base. We've also asked, again, now we're looking at post-workshops, what have nurses valued and gained? Networking, as you can see, they're having fun as well, not just networking. Hearing inspiring leaders, Stuart and others that have participated. Opportunity for new skills and tools, generating those ideas. A can-do attitude, understanding management leadership. It's not the same. Okay, so what does that actually mean in our roles and responsibilities? Recognising the importance of mentoring. So a whole range of concrete issues that nurses have said, this is what we're valuing, this is what we're gaining. Continuing with that, we've also asked about what have you changed? What actions have you taken? Again, looking at post these workshops, networking, collaboration, cultural change, opportunities for professional development, engaging Medicare Local staff, leadership roles. We also had one instance of one of the nurses participants said, we've actually applied for a Medicare Local board position, actually taking those actions. Not just, some of these are intentional and others are actually real. And that's what we want to follow up in some of our interviews, saying, what actions have you taken and how's it going? Because in our post-workshop, we're also asking, what are those enablers, what enablers exist? What are some of the barriers that exist to you taking actions? Guess what? We're seeing a very similar list again. As enablers, there's the passion, there's the confidence, planning, but again and again, there are those barriers. Time, workload, the culture that we work within, the lack of recognition, the funding support, the lack of understanding, strategic planning, confidence. Again, these patterns are building up over and over as we've been asking. And it's, again, we've known a lot of this, but again, we keep building this evidence base. Again, we've asked, what do you need post-workshop at an individual level, at an organisational level, and at a systems level? Because we want to keep building this picture. Pre-workshop, post-workshop, and then again in hopefully 2 or 3, not weeks, but months' time, if we can actually interview a sample of nurses. At the individual level, recognition of the roles, and again, those opportunities for professional development, skill sets, knowledge, job security. There's such a listing of them. At the organisational level, again, respect and role recognition. That's got to be one of those key things that have gone through every single survey and interviewer. Role clarity and recognition and being valued. Opportunities to share, mentoring, perceived need in having a leadership role. Again, that culture. That organisation also talks to me about authorised environment, and it's a term that's cropping up over and over again in a lot of the work we're seeing. What is the authorised environment within which nurses can take a leadership role in a clinical professional sense? What is authorised environment? It's about the culture. It's about the regulatory environment. It's about all of that. It's about a lot more. I'm trying to understand that because the evidence base doesn't quite exist. We've also, again, going into the systems level, similar things again, what you've said before workshops and after the workshop. Financial support is needed, development career pathway, professional bodies, education, governance. Okay, so there's those patterns clearly there. We've also asked, what can the role of peak bodies such as AMLA, APNA, Australian Nursing Federation, Medicare Locals be to support nursing leadership? And these, I guess, not reading them all out, but it's about creating those opportunities, role clarity, provide education training, advocacy, resources and networking opportunities, all of which is already happening, but is it cohesive? Can we do more to work together? Okay, so let's take a bit of a breath. That's the Nursing Leadership in Action workshop. I just want to present a couple of overheads related to the nursing demonstration project because we're really just starting to do some of those interviews. So remember, there's 12 Medicare Locals out there funded to do nursing or develop a project on nursing leadership around facilitating education, identifying and nurturing nurse leaders, and then expanding those support networks. Just a quick snapshot now. How are these projects contributing to nurses? So we asked them, okay, building confidence, building communication, building knowledge, establishing nurse clinics or nurse-led clinics, developing systems, developing governance. So all of those, again, some of those big barriers or challenges that exist there, this is what some of these projects are trying to address. Big challenges, and often I think, what is within their sphere of control, sphere of influence, but they're having a go. We also then ask, what are some of the contexts that you're working with? What's some of these influences? Not putting them into barriers and enablers, but at the individual level, they've talked to us about actual awareness of practice nurses about the issues, the confidence of nurses, the engaging issues. The workforce is part-time, so really that workload. And a word that's creeping is threat. And this is exactly, there's a threat from the practice managers, from our GPs, from our other allied health professionals, and more. These are real issues we need to put on the table. Workforce dynamics, and then those timelines. Okay. We also asked about sustainability, because anybody who knows me, I'm a front-end evaluator, but I always think about sustainability to inform future decision-making. And this is what some of the projects interviews have revealed so far. Yes, finance, money. There's need for more integration. Support structures, up-to-date information, recognising that value, governance. So again, a whole lot of skill sets, opportunities, and knowledge is critical to that. What we've tried to do now is, as I said, evaluation capacity building, rather than putting up more and more lists of key enablers, key barriers, etc., what I've tried to do is actually use an evaluation capacity building framework. So these are four domains that I think about always, about not just doing evaluation, but actually using evaluation, because that's what evaluation capacity building means to me. So what I'm suggesting here is that if we are truly committed to fully realise nursing leadership at a clinical or professional level, we really need to try to support nursing leadership at these four levels. Within the organisational environment, there is work to be done at the GP practice level, role recognition, practice and team support. Within Medicare Locals, as an example, for governance support structures, we need to build that workforce capability around skills, qualities such as confidence and scope of practice clarity. Further building those peer support networks, supervision. We need to keep building those resource availability, whether it be funding, incentives, communication system, and the evidence base. And lastly, and this is not last at all, it's that learning environment. It's about having those opportunities for professional development, career pathways, and integrated clinical education. That's my way of summarising where we're at now. We're not even halfway through this evaluation, but there's a story, there's a rich evidence base we're collecting from a range of different perspectives and also from key stakeholders. I'm hoping I've done justice to reflect back some of your voices, some of your needs, your wants, your experiences, and there's a lot more to come. I wanted to end very quickly by who I consider not just as one of my gurus, Albert Einstein, but I actually want to refer to Wade Davis. Wade Davis is an explorer in residence at the National Geographic Society. I often put up this quote from Albert Einstein, but I often don't get a chance to talk about Wade Davis. He is one of the leaders, Stuart. He is one of the greatest communicators, an anthropologist. And in his book, The Wayfinders, Why Ancient Wisdom Matters in Our Modern World, he referred to this quote by Albert Einstein. The intuitive mind is a sacred gift, and the rational mind is the faithful servant. We've created a society that honours the servant, forgotten the gift. Please, I beg you as an evaluator, let us hold that gift to us. Let's not just go on and forget about our intuition. Thank you very much.